Hello, Danny. Would you please tell us how you came to Israel and how you started this work that you do in Israel?
Okay, I'm Danny Brom and I came to Israel in 1988. But before that, since 1979, I have been working in the trauma field in the Netherlands and founded, together with other people, the Dutch Institute for Psychotrauma. Um, and have done a lot of things, an outcome study on brief psychotherapy for PTSD and all kinds of other things in the Netherlands. And then I came to Israel thinking no one needs a Dutch trauma specialist to work here, because basically there's so much trauma here. And the most interesting experience I had was that I started to work in an outpatient clinic, general psychology, psychotherapy. And one of the first things people said is, we know you're a trauma freak, but we don't see trauma here. And I said, what do you mean? I said, well, there was another guy here from Holland, Onno Venderhart, a well-known trauma person. And we looked for traumatized people in the clinic, and they're just not here. Which was really interesting, and I, of course, thought, what is this? Started to do some research on it and found out that 1 out of every 6, at least 6 patients who came to that clinic clearly had either primary or secondary diagnosis of post-traumatic stress disorder. So I came to the conclusion that they were right. They were saying, we're not seeing it, but it was there. And so quite soon after I started to build this center, the Israel Center for the Treatment of Psychotrauma, connected with the Herzog Hospital. And starting to invite people to Israel to train and to start developing the field. There were some people in the field, but not a lot. And it took some time before there was enough activity to start as a separate center. And once that happened, we did a lot of work in the school system, what we called building resilience in children. But not only that, also trying to find out who are the children that need more. And here again, I found the Ministry of Education who said, don't do screening because then we know, which was interesting. Apparently when there's a lot of trauma around and when there's war, there is this strong need or urge to not know. And that is something that we are fighting with a lot. One of our current programs is basically looking at what does military combat service do to young people. There is a compulsory service here in Israel, and people go through a lot of bad things, but there's no transition to civilian life. It's as if there is this dichotomy. It's either you have post-traumatic stress disorder and then you need treatment, or you have nothing, as if you're not influenced. And I compare it sometimes to the idea that you can go into a pool or into a lake and swim for half an hour and get out and be not wet. And it's interesting that this is so deep into our system that there is no transition. People just don't talk about it. And we started a transition program some 7 years ago to help combat units, because they're very connected, the whole unit, and give them time to process their experiences. And what we see is that when you do that, things really change. It's sort of a culture change. People can talk about it. You just have to give them the listening ear, and then they're very happy to do it. And this is only an example of what in Israeli society is needed.
Mm.
The most important organization dealing with Holocaust survivors started only in 1987 as a private initiative, not funded by the government. So you can ask, what is this? So again, the difficulty to recognize and give space to traumas when you're still in existential fears, which are very much here in Israel. So in the trauma field, we are basically looking in a broad way. We're not looking only at PTSD and treatment. We're looking at how can we prevent. We're looking at how can you make people give space to trauma and see what it does, because it does so many different things, and not only psychopathology. In the past few years, we've become interested in that not so clear concept of post-traumatic growth. Some people say post-traumatic growth is just a cover-up for difficulties to cope, and in some studies there is a correlation between post-traumatic growth and symptoms. The more symptoms you have, the more growth. So that's interesting. In our studies, we don't find that connection, but we find that if you work with people, you can really increase the feelings of knowing that now I know what is important in my life. I value my friendships more. I find new opportunities. I'm looking now more for what is meaningful in my life. And that is in itself a whole interesting field. There are other clinical fields that we are looking at and trying to develop, like to work with people who are chronically have chronic post-traumatic stress disorder, and treatment hasn't helped them. What do you do with those dysfunctional people for years and have gotten all the treatment, and then what? And there is a need to look at that group, because it is one of the most vulnerable groups. In terms of our research, we are now looking at longitudinal studies of children who grew up in a war situation like in the south of Israel, and now have data that show that, well, as all traumatists know, trauma is not good for the person, but we see how long-term the consequences are when you're traumatized at age 2 and 3, and when your mother is also traumatized and has high symptoms of post-traumatic stress disorder. That is a very bad beginning, especially, and we find as the mediating factor, the ability of the mother to regulate her own emotions. If that is a problem, then you see a lot of problems in the children.
Do you work with them both together, mother-child
Yes,
groups?
there are several initiatives that work with mother and child. One is a group method that we have developed together with specialists at UB University to look at how can you help parents understand the needs of their children, even when you are yourself fearful. Because when you are fearful, you just want to protect your child, and then you basically are not looking at what the needs of the child are. You're looking at your fear. So how can you make the attunement better between parent and child? And we do that in groups in the south of Israel, and also started to do that in the Bedouin sector in Israel, where there are enormous needs also. So looking at where we are going in the future, I feel that the concept of resilience is basically going down a bit in the literature, because it's not so clear what it actually is. And instead of that, we're looking at more operationable concepts such as emotion regulation. How can you teach children emotion regulation? We have a program called BEAR, Building Emotion and Affect Regulation, and we're looking at ways of how to develop that field more, both for parents and for children. And if we look at the situation in the Middle East, we will need a lot of that, because it's so clear that if there's no emotion regulation, then racism and hatred of the other are rampant. And we live with this sort of illusion that if we can help people regulate better, that maybe we'll become a bit more friendly to each other and to others. I can't speak about the bigger word of peace, but at least the name of our soldiers program is peace of mind. Because in this situation, and the situation really doesn't look good, politically not, and militarily not, and we're in a mess. But at least we should try to help people have some peace of mind, so that they can listen also to the others who live here.
And maybe just one word, if you don't mind, about Nepal. You just had some of your staff members come back from Nepal. What did they do there? What did they see?
Well, we've been involved in several humanitarian aid actions, both in Haiti and in Sri Lanka, and after Katrina also in Biloxi, Mississippi. And now in Nepal, we're trying to apply what we've learned in other places. And one of the things we know is that if we will be involved there, we need to be involved there long term. And that is, there needs to be built a infrastructure of support and help on different levels. And that there is no infrastructure there for psychosocial services. So we send two people to really look at what the needs are, what the possibilities are, who the local organizations are that we might be able to work with, just as a sort of a beginning. And now we have to understand if we can be of help there, because of course that's something that Israelis really want to do. That is, go out and see whatever we learn here or in other places, that we can apply it, which gives us a sort of a feeling that we're not going through all of this and all of the hard things we go through for nothing, but that you can learn from it and then apply it and give it to others.
Thank you so much. It's very well said.